because it did slide in some open discussions. For the meantime, I want to introduce Juliet. Who pays zero insurance for everything? Your health care is great. No one.
The VA. The
Who pays a
VA.
lot of, about say you're probably a Medicare.
Military.
No, military.
Home delivery truck?
Look at this room, it's pretty much Medicare.
There you go. I have a problem with my business
Well, I'm
because
VA.
healthcare used to be affordable for my employees, and we included it as a perk. Well, next thing you know, family plan right now that we pay is about $25,000 a year. Used to be $7,200 a year. Now we're up to $25,000. I can no longer offer it. What I did personally is I went in a different direction, which brings up our next guest, Julia. I went with direct cost sharing.
Yeah, medical cost sharing.
Medical cost sharing. I have been doing it now for about a year. Now, here's the thing with me. I am like Adonis. I am in perfect health. It might not look like that, but at the same time, my wife and I don't go to the doctors that often. We go for a yearly physical. It's fine. But even if you did have something bad, well, a lot of it is covered. And it's probably covered to the point where it's going to be better than an HMO where you have deductibles and then your co-pays. I talked to somebody this past week and we're just talking about health insurance. And it's like, oh yeah, you know, my wife has health insurance. I get it through her. However, she has a $15,000 deductible. I'm thinking, $15,000 deductible, and on top of that, you're going to have a co-pay afterwards? I said, you're probably paying like $25,000 a year. Yeah, that's about right. I said, no, there's a much better solution. And Juliet will tell us about it. Clicker here.
Yeah, well, thank you so much, Mark. So, yeah, I would love to get just a lay of the land here. Who does have private insurance through like the marketplace? Perfect. And then we do have some Medicare folks in here by chance. Just a couple. Okay, so this particular option would be, you know, we have an employer group membership. That's going to be for small teams or large teams. Mark did share with me, though, that the majority of you are just self-employed. Is that correct? Yes. Don't have small teams. Okay, so I'm going to be gearing today's conversation to the self-employed. Who has heard of medical cost sharing communities? A few of you. So some of those stem from the religious-based medical cost sharing community that have been in place since like the 80s. You may have heard of MediShare, Liberty, Christian Health Ministries, Samaritan, just to name a few. So those have a religious aspect, right? They have you know, certain beliefs that you must adhere to and believe in to join those types of communities. That's where Sedera is different. We founded ourselves, our founder in 2014 came up with Sedera, and he actually was a member of the Samaritan community for years and years and years, had many medical instances shared through that community, and he didn't really believe that it should be just for a certain religious aspect, just for Christians. He wanted to open the doors so that could be shared with everybody, and so that's what he did with Sedera. We originally opened our doors to employer groups to be able to have a more affordable solution. Like Mark was saying, he couldn't afford insurance for his team anymore. We wanted to open the door for employer groups to be able to have a more affordable solution. That started in 2015, and then we launched our individual product in 2018. I was actually a member of Sedera before I started coming to work for the community, and I was so blown away that with an emergency C-section and my son spending 10 days in the NICU, just a show of hands, how much do you think came out of my pocket for that? Like, or just a guess, rather, not a show of hands.
10 grand.
How much?
$10,000.
$10,000.
For what? Your previous insurance or this insurance?
For this option. Like how much?
300.
300? 500? 500. Yeah. So $500 came out of my pocket, and the rest of those costs, which were I think for the emergency C-section, it was around 20,000, and then my son staying in the NICU was more than that. But yeah, $500 came out of my pocket, and the community shared the rest. And so you better believe I was like, hey everybody, look at what's over here. Like, look at how this works. And so I was already selling it to everybody I knew, and so I was like, I just got to go straight to the source. And so I've been a member since 2017, and I've been working for Sedera since 2018. So we're just going to walk through what this looks like. It's a more affordable way to manage your healthcare costs. It's just learning a different way to do it. If you have a $15,000 deductible, or if you're paying $25,000 a year for your premium, you're already a cash pay patient, and that's what you are with Sedera. So, you know, it's just like, so let's just open our minds and learn a little something new. So, we all know about the medical debt in America, right? There's like bankruptcies happening because of medical debt. You've read all of the articles about hospitals and how they are, you know, sending people to collections, and, you know, they're making these people, you know, pay off their debt. So they account for 40% of all bankruptcies in the United States. Just like Mark was talking about, you know, in the past like 20, 25 years, the increase in individual premiums and for families has just continued to just skyrocket over the years. And so for families on a plan, I have seen anywhere from $1,600 to $2,400, you know, on family premiums right now. So this is a different it's a different way to pay and manage your healthcare costs. So we are a medical cost sharing community. You can think of us as a big, large room of people just like this. We all pitch in a monthly contribution every single month, and then when there is a need in the community, let's say this gentleman right here falls down while he's hiking, he twists his ankle, maybe it actually ends up being a fracture, and he goes to the urgent care, he has to get x-rays and then crutches, physical therapy. That is one incident, one medical need in the community. All of this money that we've been gathering month over month, there's funds to pay and help this gentleman get the care that he needs. And so we also empower members with tools and resources, and so we're going to walk through all of that and what that looks like. And then if you guys have a question, like, please raise your hand. Like, let's have a, yes, perfect.
Suppose your costs are more than the money that's collected.
Yeah, so you're just going right there to it. So, and the guidelines, like, so it's a really valuable, you know, question that, you know, we always get there at the end of the day. So, in the guidelines, it is written that if we have a month or a series of months where the money coming in is less than the needs of the community, the medical costs of the community, we could choose to prorate that particular month, and we could pay 80% of all of the needs of the community that month. The next month, when it rolls over, those fresh contributions come in, we would have new funds to pay, we would catch up that extra 20%, and then we would have funds for that month. In the history of the community, we have never had to prorate. In the guidelines, it's written that if it happens 3 months in a row, we're going to take a look at that. Like our community stewardship board, our board, we're going to look at that, and we're going to raise the rates together. It's kind of like raising the barn, right? We're all going to do it together. And so if the medical costs, you know, in the United States just keep on going up, sometimes there will have to be rate increases in the community. That being said, the cool thing is that back in 2014 and 2015, when we first started the community, we saw a surplus of funds, so we knew that we were overfunding the community, so we decreased our rates. How many times has that happened with insurance? Anyone? And so, just one second, let me finish my thought, and then you go. And so since 2015, I believe that we have had 4 rate increases, and those range. We're going to get into what that looks like, but the different levels. Sometimes it's 10% on this one and 5% on that one, but it's usually, it hasn't been more than 10% on those over the years. Yes.
Existing conditions covered?
Yeah, we're gonna review pre-existing. Yeah, good question. So resources. We're gonna empower our members. We're gonna give you tools. We're gonna help you along your way, and we're always gonna be there. And we're gonna talk about each one of those. So you can kind of look at our community in this little circle here. Every member is a cash pay patient. So kind of like we said, if you're already paying $25,000 a year in premium, and then on top of that you have a $15,000 deductible, you're already paying cash for your medical procedures. So when I say every member is a cash pay patient, that is how we present ourselves when we go to the doctor or the urgent care or the hospital. I am a cash pay patient. When they ask, do you have insurance? You say no, because I do want to make clear that this is not insurance. This is not insurance. This is a medical cost sharing community. You're a group of people sharing each other's medical costs. So there is no layer of insurance in how the community works.
Is it deductible?
We do have a what we call an IUA, which is an initial unshareable amount, and so I'll review how that works too. So you do have a personal responsibility, yes. When we have a whole community of people who present themselves as a cash pay patient, I'm sure that you've heard when you go in as a cash pay patient, oh, well, I'm gonna take 50% off of that, like the doctor or the urgent care says. That amount equals what the insurance company typically ends up paying, right? And so let's just have an example here. Let's say you go to the urgent care or the ER and it's $5,000. You get this bill from your EOB and you see on there, oh, well, I have United Healthcare. These charges were $5,000. I am so lucky that I get a $2,500 because I'm in network. And then that is what is paid by your insurance company to the provider. When you're a cash pay patient, you just pay the $2,500. So at the end of the day, it's the same amount of money. The community is sharing that lower cost. And so when we have a group of people that are all presenting ourselves as cash pay patients, it's just one way that we control the cost for the community and help that community stay within funding limits.
Are you considered in the network then?
We do not have a network.
So that doesn't really
Yeah, you'll
apply.
notice right down there, freedom of networks. So we're never going to dictate who someone can and can't see, who they can and can't see, and where they can and can't go. We always leave that up to the member to make that choice.
So how do you get that, instead of paying the $5,000, how do you get that $2,500?
By being a cash pay patient.
Do you negotiate that with the hospital?
There is,
or-
yeah, sometimes there is a negotiation process that occurs. So if a member submits a bill to the community and it's like $25,000, we will go, that patient will be linked up with Point Health. Everything will be guided and will be right there in line with the member the whole time. But that Point Health goes in, they deal directly with the provider to get to a cash pay friendly rate. And that is what is shared. Yeah.
So is that done for, you have to do that, like, let's say you go to the doctor and you're like, you know, my elbow hurts, okay. So he's gonna refer you to a orthopedic guy, and you have to go to that doctor, so that's another doctor. And oh, you're gonna need surgery, you know, you need to schedule you for surgery. And then you go in for your surgery, you have your surgery, and then you have your rehab, and then maybe your medicines or pharmacy bill on the side. So you all will contact each doctor or each?
When it's the smaller visits, like the first ones that you went to go see, no. We're just gonna pay the cash pay rate that you, when you went to your specialist or you went to your provider, you just asked for a cash pay rate. And so we're not gonna deal with the smaller things. It's the larger items that we really wanna keep within that threshold of affordability. Yeah, and so, and I'm gonna walk through too what it looks like when you have just a big event, like you go to the emergency room and something really bad and crazy happens, compared to what you were talking about, which is little costs that then add up to something larger. Yeah, so I'm gonna walk through what that looks like. Yes.
Does every doctor take that?
So, yes, every doctor accepts cash.
Yeah.
Well, I hope, I mean, yeah,
I have a lot of cash.
yeah, yes.
But if I have
Get on with my bucks.
you know, I say I'm a cash paid person,
Yes.
and they say your bill's $1,000, and they want their $1,000 right then and there, so do you mail me a check back?
Yeah, so what that looks like, so if you're in the urgent care, let's just say, we haven't dove in yet to like our equivalent of a deductible, but I am gonna review that, but every need, every incident or illness that you have a personal responsibility of that. So let's just say that your IUA, that initial unshareable amount, was $1,000, then yes, you have that $1,000 responsibility. If the bill was $2,000, then you could say, hey, may I pay $1,000 today and be billed for the rest? Yeah.
Good.
So you get reimbursed the difference after you negotiate?
Yes, and we are there along with you during that negotiation period. So for members who are just getting into this, it's going to feel different, right? You don't have an insurance card to drop down, and that feels different, especially if you've had that for 20 years. So there is a learning curve to learning how to ask for a cash pay discount or say I'm a cash pay patient. And so our team is there to just help those new members. And if you're experiencing anything, that first time around, I really suggest, hey, let's get in touch with our team, because the more communication a member has with our team, the smoother it's going to go.
So if you know you gotta go to the doctor, and that's the nursing, you know you gotta go to the doctor, you know that bill's gonna be so much, call you first, you call them and say, hey, this guy's coming in cash, don't charge him so much. Does that work?
Can you say that again?
Let's say I know I gotta go and get an x-ray, for sure. I know that x-ray's gonna cost about $2,000, let's say. Should I call you first before I call you?
Yes, absolutely, because we're going to go through some resources, especially for like diagnostic scans, because I don't know if you're aware, but like you can get the same scan over here and it can cost $3,000, or you can go across the street and do a cash pay one, same type of machine, and it can be $400. So if you know you need something like that, we have resources to help you, 100%. Yeah.
One of the things that I've run into is if I go to a specialist and I tell them that I'm cash paid, it's slightly more than what my copay was. I go to an eye doctor yearly for a checkup. My copay was $50. They charged me $75. So,
Yeah.
they all take cash. I have a friend who, she had 3 kids and she did not have insurance, and when she went to the pediatrics, she told them she was a cash customer. She was paying less than what I was paying to my daughter with the copay. So yes, they will take cash and they will discount.
Yeah, so let's get into chatting about how medical incidences are actually shared and what it feels like. So you'll see on here too that commitment to a healthy lifestyle, that may mean something different from this gentleman to this woman to that woman to that woman. But at the end of the day, we all do commit to a healthy lifestyle. The healthier we are as a community, the lower costs we're going to have to share. And then lastly, sharing on a per need basis, that really starts the conversation of how medical costs are shared through the community. So you'll hear the word need described throughout our guidelines, throughout the Sedera website. And so a need is one or more medical expenses caused by a single injury or illness that exceeds the member's IUA. And so IUA is initial unshareable amount. It's what you as a member feel like you can be responsible for before sharing kicks in for the community. It's kind of our form of a deductible, but I'm not going to call it that because I don't want to confuse insurance with medical cost sharing. So you'll notice here that we have 5 different levels of IUA options: 500, 1,000, 1,500, 2,500, and 5,000. So the higher your IUA, the lower your monthly contribution is going to be. So I usually tell members, really think about your finances on like your yearly annual basis. If you have a car wreck and your whole family's in the car and each person has injuries and you're all a member of Sedera, one dependent is going to have, let's just say you joined at the $1,000 mark, their injuries under that $1,000 IUA. And then you are going to have your injuries that are going to be dealt with another IUA. So every incident on every single member, it has an IUA attached to it. And so you'll notice there at the top, we kind of talked about this gentleman falling down and hurting his ankle. He's sent to the ambulance. He goes to the hospital. He has diagnostic imaging. He's sent home with crutches, and then he has physical therapy. All of that from beginning to end, even if it transfers over your membership year, it doesn't reset the IUA. It is the same IUA until you go 12 months symptom and treatment free. You'll also notice down here at the bottom, 3 IUAs in a membership year. And then the next, 4th eligible need is fully shareable. So that is on a per family basis, or if you joined as an individual, it's just for yourself. So if you have a family of 8, it's 3 IUAs for all of you. Once you hit that, then the next need level that you hit would be shareable from $1. Does that make sense?
So if you take a $5,000 IUA, your maximum responsibility is $15,000 per year.
$15,000. I will say though, like let's just talk about if a couple small things happen, like a smaller injury, maybe you get a cut and you have to go to the urgent care for some stitches. That's really not going to total $5,000, but it could put you over the $15,000 mark. So to be eligible for it to be a 4th need that is shareable in full, it does have to hit that need status. Yeah. So let's do another example. So this is an actual real life example. This comes from a family of 4. They joined at a $5,000, or I'm sorry, their health insurance had a $5,000 deductible. One of their children had recurrent ear infections. Many trips to the doctor, many different types of antibiotics and things to treat that, and then eventually getting ear tubes at a local hospital. So this is, John, just exactly what you were talking about, little charges that kind of add up over time that eventually hit your IUA, but they're all part of the same illness. And so when you're in that type of need, you want to just track your expenses as you go. You can go ahead and start a need in the member portal and just say, hey, I spent $55 at the primary care. His son was having recurrent ear infections. A couple months later, you go back into the member portal, you add more expenses under that same need, and our team's going to respond and just say, hey, you know what, you haven't hit your need status because you haven't hit your IUA, but you're going to keep on adding expenses under that same need. And so what this looks like, this family, on the left is health insurance, on the right is Sedera Medical Cost Sharing with a $1,000 IUA compared to a $5,000 deductible over here. So not only was this family paying, almost $2,000 or $20,000 on annual costs for their premiums, they had additional out-of-pocket costs for their co-pays, their prescriptions, as they went through those first few doctor visits trying to get rid of these recurrent ear infections. Then they were like, oh my gosh, he has to go in for ear tubes at the local hospital, $2,100 out of pocket because they hadn't hit their $5,000 deductible yet. Over here on Sedera, you're going to be paying out of pocket, as you're going through and presenting yourself as a cash pay visit for those first few visits. And then once you hit the $1,000 IUA, your surgery is going to be shared completely. What this doesn't show is that this happened in the fall. Their family deductible reset in the new year, and the child's ear tubes fell out in the spring, and they had to go in and get that ear tubes replaced. Another $2,100 came out of their pocket. Had they been a Sedera member, how much would they have paid for that second surgery? Zero! Yeah, you're right, exactly. Because it hadn't gone 12 months symptom and treatment free. It's the same need, and so that second surgery would just be shared just like the first. And then you add in the annual cost for a family of 4 over the age of 30, and the total at the bottom is pretty remarkable. All right, so we're going to just start talking here more about the resources and different things that are part of your membership, and also what is included, what is shareable, what is a shareable need. So medical incidents, injuries, illnesses, and then they must be done by unlicensed medical providers, but things like emergency rooms, urgent cares, hospitals, all of those things are shareable medical events. Pre-existing conditions. So yeah, let's talk about that. We take a 3-year look back, and we ask that our members note any diagnosis, surgeries, medications, like anything that has gone on in the past 3 years do become your pre-existing conditions and have some sharing restrictions around them. And really this is to protect the community. We don't want someone joining and then second month being like, I need a hip replacement. These just arrived that I just, haven't been feeling this at all, and then hopping off in month 3 after they get that, however much a hip replacement costs. So that would really be challenging for the community. So your pre-existing conditions have no sharing in year number 1. In year number 2, it tiers up to a $15,000 sharing limit per pre-ex condition. In year number 3, it tiers up again to $30,000, and then in year 4, it becomes fully shareable with the community. So high blood pressure, diabetes, all of those things are pre-existing conditions. However, if you have to go to the hospital, like an emergency room, like let's say you have a heart attack due to your high blood pressure or something like that, the emergency room would be shareable. But once you go back to the follow-up visits for your pre-existing condition, they would remain unshareable. And so I always want to point that out because if it's a true emergency basis, it would be shareable with your IUA.
What if you go to the hospital, emergency, and they check you into the hospital, and you're there for a week?
Yeah, so
You
it's
have to have surgery, bypass surgery. I mean,
yeah. So the emergency room would be shareable. Yes.
just that.
Yes. Yeah.
Okay, let me jump in that real quick. For example, I have a heart condition, so I don't qualify for this at all.
No, that's not true.
Unless
So
I'm
we
in-
don't
unless I'm
say,
in the 4th year.
well, we don't say no to anybody. It's all
I don't, until the 4th year, I have to pay everything out of pocket.
correct.
And my wife has cancer, so
If she, cancer is a different beast. So if she, if she's been in remission for 15 years, that's one thing.
1 year.
But if she, and one thing, I think that's taking too big of a
So
risk.
we have to pay everything in full out of pocket until the 4th year. And
Correct.
that's another benefit.
Correct. Yeah. There would be $15,000 available though in year 2 for that need. If you smoke, or if you're any type of tobacco user, vaping, there is a $75 surcharge per month. If you are a tobacco vape user over the age of 50, there is a sharing limit of $25,000 for any tobacco-related illnesses. So definitely something to consider there. Maternity, having a baby on Sedera, I mean, it was quite a remarkable experience. Like I said, only having $500 for that need. On the individual membership though, it's an automatic $5,000 IUA if you, and that includes your prenatal care and the delivery. Or an emergency C-section is also considered under $5,000. If you're having an elective C-section, your IUA can go up to $20,000.
Just wondering, if somebody had normal insurance, what would the cost be for being delivered?
Yeah, well, I think that they would have to meet their deductible. So you definitely have to look at their deductible and then their co-insurance. And I mean, it's going to be different on every single plan. Yeah.
I wasn't planning on having a baby anytime soon.
Yeah, no more babies. So there are some preventive care that is included in your membership. Once you stay with the community 6 months, you're eligible for the screening mammogram and the colonoscopy, not subject to an IUA. Prior to hitting that 6-month mark, you would just, have your IUA involved there. And then childhood immunizations and flu shots, those are also shareable in full. So what that looks like is going to get your flu shot, sending in the itemized bill and receipt into the member portal, receiving a share back within about 3 weeks.
How does, it seems tedious to be sending checks to millions of people every time, or do you have like an account?
So a couple things. So the individuals right now, when you enroll in Sedera, you actually open a sharing account. So that's a part of the enrollment process. You also link your personal account to receive shares. So you're going to be doing 2 different things there. And so we share money directly to members for them to pay their provider directly. And we share money to we direct deposit money into your existing bank account. Yeah. My next question usually is, what if I take the money and go to Vegas? So, your name is on these bills, not Sedera. So you are a cash pay patient. This is your, your account with the provider. If you don't pay them, you're going to be sent to collections. So, and then later, if there's any follow-up visits or anything like that, like our needs team would see on the itemized bills, like, hey, there's these outstanding balances here that we've actually shared money to this member, and that member would be terminated. So it's kind of a fun, interesting conversation though. Okay, so we're going to talk a little bit about things that are included in your membership, resources and things that you guys just have on hand that are included. So 24/7 telemedicine, if you guys have used things like Teladoc, that is what this is. It's available for all of these things and you don't have to pay a dime. It's available for you and your dependents. And then also behavioral health and dermatology for an additional fee, and I think it's $75 per visit. But they can help with all of those types of counseling issues for depression, anxiety, marital or family issues, and small dermatology things that you can just take a picture and have a virtual meeting.
So they'll write you a prescription?
They can, yeah. They would usually send it into what pharmacy you go to, yeah. So yeah, let's talk about medications. So again, you're always going to be a cash pay patient for your medications. We have the RX Marketplace is located in the member portal. You always have access to that. It works kind of like GoodRx. I have GoodRx on my phone all the time. If you guys don't have that, it's an amazing resource. Like I saved hundreds of dollars on my son's seizure medications by going 2 miles down the road. So it's a great tool. We view medications in 2 separate buckets, maintenance and curative. Maintenance meds, usually you're coming on board Sedera with, or you get diagnosed with something and then you're on a maintenance medication. Those are going to be sharing eligible for the first 120 days following a new diagnosis. Keyword is new. So if you come into the community with a maintenance medication, they would not be shareable because it's not a new diagnosis. Curative meds, antibiotics, pain meds due to a car accident or post-pregnancy, chemotherapy drugs. Those are curative meds. Those are shareable in full right along with your need after you hit your IUI. So we have 2 different tools. Our medical concierge is available through the member portal or by calling our member services team. This is for the kind of like the smaller things, easier, smaller diagnostic scans, x-rays, ultrasounds, medications. We've had great luck with teams getting people getting insulin for extremely low cost through our medical concierge. So anything that you are looking for the best value on, you can go through medical concierge. And the next thing is called Savos. So this is for surgeries, more expensive diagnostic scans, anything that is shoppable, but definitely like surgeries. We're going to be looking at how much is the surgery that you're needing, what's the benchmark for affordability in your state. And so this is all part of your Sedera experience. It's built into the product. It's to help the community keep those costs down. And I've mentioned a few times just about especially if you're a new member, just learning, just how to be a good member and how to present yourself as a cash pay patient. And there is a learning curve, and our team is really great with change management. Some of these team members have been on board since day 1, and they're still here, still using people's first names. They build relationships with our members, and I just can't say it enough about our member services team. And so any small questions or big questions, they're just here to help you learn how to be a medical cost sharing member. This is an example. So on the individual product, we have 5 different age bands. And so I've only pulled up the 30 to 39 age band. You go by the oldest partner in the family. So if the wife is oldest, she would be, who the age is based off of in your little family there. And so it's like 18 to 29, and then it kind of goes by decade. This membership does cut off at 65 when you become eligible for Medicare. And so you'll just notice here that, member only across the top, if you choose a $500 IUA, that'd be $288 per month. and so on. The 1,000 goes down to 280, 1,500 to 252, and so on. Has anybody heard of direct primary care, or DPC for short? Yeah, do you have one?
Yes, I do.
Okay, sweet. That is a wonderful type of doctor to pair along with your Sedera membership. A DPC is a doctor who is like not in the insurance business, so they don't take insurance. Instead, they take a monthly membership fee from their patients, and in turn, you get unlimited access to that doctor. And so there's no co-pays. You can see that doctor or have conversations with them 80 times in a month, and it is included in that one membership fee. And I cannot tell you how wonderful it is. I've had one for my family for years now, and I can text them and just have a conversation. She knows my entire family. I'm like, look at this huge bite, like there's some gigantic snake bite or whatever, like what is happening, or my child has been, congested for 5 days now, running a fever, and she will have a just conversation. Sometimes I do actually need to take a visit and go see her personally in office, and they do have brick and mortar locations. The high quality of care that a DPC gives, we understand that they're taking the brunt of so much of our members' just everyday care and keeping them on track with their health, that we're going to lower the Sedera monthly membership for anyone who impairs it with a DPC membership. So these fees right here are the standard rates, and so they would be slightly lower if you did pair it with a DPC. If you want to see if one is located in your area, I have 2 resources. You can either go to the Sedera membership or just sedera.com, and there is a DPC finder map. Or the other one that is really good is dpcfrontier.com. And if you go to that website and just scroll up a little bit, you can put your zip code in, and it'll bring up all the DPCs in your area, and you can even cover or click on one, and it'll list their pricing, how to get a hold of them. So I can't say that. How long have you had your DPC for?
About a year now.
Yeah, good relationship.
As soon as I joined Sedera, I made sure that I had one. She charges me $100 a month per person, so it's for my wife and myself. And yeah, when I was up in Buffalo, somehow I slept wrong and I poked my eye. At least I didn't poke it out. But my eye turned red. To me, I was a little concerned that I had pink eye. So I called her, took a picture, texted over, and she asked me a bunch of questions. It's like, no, you just slept wrong. You probably got a quarter of a pillow in your eye. It'll go away in 2 weeks. So for me, it works out well. Personally, I don't go to the doctors often. Most direct primary care doctors got out of the health insurance business. They are strictly, this is their business model.
Yeah.
We are going to go subscription based only. People will pay us, and it works out well.
Yeah, usually
A
they
lot
have
of
like,
them, they just get frustrated with, it's like, I just work for the hospital, and this is my pay. I'm only being paid a fraction of what I am worth, and then they did this.
or if they're contracted with different insurance companies, they will have a quota that they will have to meet, and that's why sometimes you feel like you go to the doctor and you're in there, and you're like, this is going on and this is going on, and then you're being ushered out the door, and you're like, but I have some other things going on that I haven't even like spoken to you about. Yeah.
Does it cover chiropractics?
No, well, Sedera, yes, if it's due to an injury that you have received, there is some limits regarding chiropractic, but if it's for maintenance, then no.
Okay.
So yeah, for the DPC, like on your annual visit, like he or she will spend an hour with you in their office, going through everything, all of your health markers, having your blood done, and just, it's such a more thorough, deep dive of a relationship with your doctor. It's kind of bringing the doctor and patient together the way it used to be. I mean, they used to visit your home and stuff.
I actually used, on my initial visit, I spent more time with the doctor than I did with my doctor in Buffalo, who I had for over 20 years.
That's nice, that's nice.
Very thorough.
Yeah, they're
That's
great.
why a lot of doctors are getting on
Did you
track.
refill
Yeah.
or you didn't refill?
It used to be that when a doctor had a whole bill, you had to see a certain number of patients and they made his money on the practice. But nowadays, you have to see 300 patients a week.
What you do with the leftover?
And then you also have to hire someone just to do the billing for the insurance, you know, it's just like this whole other salary that you have to pay.
So Mark answered my question, what is the average cost of a DPC?
Yeah, they range.
They have range.
Yeah, I would say like $75 maybe for a single person. Some have different costs depending on how old your dependents are, so it ranges a little bit, but I would say the lowest cost would maybe be 65 to 75 for an individual.
And the highest you've seen?
Probably maybe 100 to 120 perhaps, and some even have different different levels of membership. So if you want the availability or option to go in and see them physically, that would be maybe the highest. If you want it completely virtual, there are services called VPC, virtual primary care, and it's the same exact thing as a DPC except it's all virtual.
What was the
Those would
website?
be less money, but you still would qualify for the Sedera discount.
As long as
What was-
you service it.
What was the website?
What's that?
So that's flex space for them?
Well, that's,
You probably don't remember the doctor's visits in the house, do you?
I don't remember. I mean, my mom is right back there today. She's with me today. So if doctor ever come to my house,
She would remember.
but she would.
Doctor came to my house.
Yeah. Yeah.
What was the website for the provider finder?
Yeah, so dpcfrontier.com.
Okay.
Yeah.
Anything for dental?
No, we do not have a dental as part of the sharing.
I have my knee
Yeah.
done.
All right, guys. Yeah.
They wouldn't have
Thanks so
them.
much.
Not necessarily.
Everything. Our website actually has everything you could possibly imagine. So if you just follow the information for
Oh, yeah,
individual, and then my direct email, which I'm always happy to point you guys in the right direction,
Big
is
freaking display.
It's like the
Dill, like
briefcases.
pickle, at sedera.com. So
Yeah, take pretty one
jdill
and
at
run this
sedera.com.
There's going to be a follow-up after the convention, and I will include Juliet's contact information.
Newsletter?
Did you
What's
just
that?
ask for that?
Newsletter?
Probably. Probably.
We have 30,000.
So if you have any other questions, feel free to reach out to Juliet. Also, you're more than welcome to stay for our lunch. It is lunchtime for those who did not pig out on all the snacks that we had. It's right out here. You'll see it's all set up in buffet style. We'll be meeting back here.
I want to try to get.
What are you doing out there?